Hello, my name is Brett Hiring. I am the Pharmacy Manager with BJC Home Infusion. Today we will discuss the process for placing additives in your TPN prior to administration. First, we will identify a clean, non-cluttered surface to lay out our necessary supplies. Next, we will collect our supplies. We will need at least 1 saline flush, 4 alcohol pads, 4 AA batteries, our CAD pump, CAD tubing, and our medication. Next, we will perform hand hygiene. To do this, we will wash our hands with warm water and soap for at least 30 seconds. It is important to work up a good lather and properly clean all surfaces of your hands, paying attention to get spaces between fingers and under fingernails. It is best to utilize paper towels to dry your hands, as dish towels can harbor bacteria. If you do not have access to a sink and water, it is sufficient to utilize an alcohol-based hand sanitizer, as long as your hands are not visibly dirty, though the hand sanitizer must be at least 60% alcohol to be effective. To utilize hand sanitizer, we will place a dime to quarter size amount in the palm of one hand. Utilize the same procedure as hand washing. Make certain to cover all surfaces of both hands with the hand sanitizer. Again, paying attention to get spaces between fingers and under fingernails. Then allow the hand sanitizer to fully dry. Now that we have performed hand hygiene, we will put on gloves and are ready to place all ordered additives into the TPN bag. To add vitamins to the TPN, we will utilize a 10 milliliter syringe with needle. Vitamins are supplied in 2 vials. First, remove the syringe from its overwrap. Place it on your work surface. Grab your vials. Use your thumb and forefinger to remove the dust cap from the vials. Next, we will swab the top of each vial with an alcohol pad. With a different alcohol pad, we will swab the additive port of the TPN bag. Pick up your syringe. For this, we will be removing 5 milliliters from each vial. Pull back on the syringe plunger to draw the same amount of air into the syringe. Uncap the needle. Place the needle on the vial top of vial number 1 with the bevel facing up and the tip of the needle closest to the vial septum. With a fluid, brisk motion, move the needle upright and into the vial septum. Now, invert the vial. Slowly push air from the syringe into the vial, then pull back on the syringe to move medication into the syringe. Repeat this until you have the proper amount of medication in the syringe and all air has been expelled. Remove the needle from the vial. Now, pull back on the plunger to move 5 milliliters of air into the syringe. Place the needle onto the vial top of vial number 2, with the bevel facing up and the tip of the needle closest to the vial septum. With a fluid, brisk motion, move the needle upright and into the vial septum. We will now invert the vial and repeat the previous procedure. We now have 10 milliliters in our syringe. Making sure not to allow the needle to touch anything, insert it into the additive port of the TPN bag. Push down on the plunger to move the medication into the TPN bag. You may be ordered to place other additives into your TPN bag. That procedure is the same as just outlined. Adding insulin to your TPN requires a specific type of syringe that you and your caregiver will be trained on. Once all additives have been placed in the bag, make sure to mix thoroughly. We are now ready to add tubing to our TPN bag. Please refer to our video on preparing your TPN or hydration infusion for further direction. Things to be mindful of during this process. Always review your medication label instructions prior to each infusion to ensure correct additions. Always make sure to perform good hand hygiene prior to each infusion. Remove your TPN from the refrigerator 3 to 4 hours prior to your dose. Times when you should contact your infusion provider. if your catheter is not functioning or allowing you to flush it, if your occlusive dressing has become wet, dirty, torn, has blood beneath it, or is coming off, if you are running a temperature greater than 100.3 degrees Fahrenheit, if you begin to develop a rash or itching at your dressing site or anywhere else on your body, any pain, swelling, redness, or warmth in the arm where your IV access is placed, any onset of diarrhea or changes in bowel habits.